blood pressure or diabetes or exercise. But this occurs also in practicing skills, in doing self-monitoring, in varying the way you use your medication, and has no end of possibilities. Our measures now, instead of being like those ordinal scales where you sort of say you're a little better, you're a little worse, you're a little the same, now are going to be measured just like that 50-foot walk. You know, I can be very precise in my measure. If I measure total activity, total amount of walking, average walking speed in the course of a day, total distances walked, I have some real-world data that is much easier to manipulate statistically and to understand. And so that will help me in designing my clinical trials. So what have we been doing with our wireless health center? Well, we basically have an iterative strategy. And the idea is you identify a problem that you think is important, you figure out what do you want to measure, and then provide a device that might be able to do that. You think about your target population. You know, who do you want to do this with? And then you think about, are there other populations that might benefit from this? So even if I aim initially at measuring people walking with stroke in the real world, walking with their hemiplegic gait, I can apply that to people with any disease, because if the algorithms are good enough, they will be able to detect the type, quantity, and quality of those movements. We also want to be able to figure out, well, do we have to look at this data immediately to give people feedback as they're doing something? Or can we give them summary feedback at the end of a day or the end of a week and then call them up and say, you know, you aren't